In observance of World Mental Health Day on October the 10th, the Student Psychology Association presents on the topic of depression, suicide, and anxiety in collaboration with PSGE introducing PSFA, Psyche presenting on PTSD, and PCA presenting on OCD. In addition, we have a guest appearance, Ms. Wendy Jeremie. Stay tuned and watch till the end for more.
Depression and suicide. Depression is a mood disorder that causes persistent feelings of sadness, low self-esteem, and contributes to an individual having low levels of motivation and interest. Depression is a feature in 70% of all suicides worldwide. Close to 800,000 people die due to suicide every year, which is one person every 40 seconds. With the lack of adequate support systems, those with an inclination towards suicide are more likely to go through with the act. Symptoms of depression include negative self-image, mood reactivity, decreased concentration, insomnia, suicidal ideation, feelings of hopelessness. Indicators for identifying those with suicidal tendencies are withdrawal of contact with others, sudden mood swings, recent occurrence of life crisis of emotional shock, personality change, giving away prized or treasured possessions. But always remember that you are beautiful, you are strong, and you are worth it. Some causes of depression are abuse, certain medications, conflict, death or loss of a loved one, genetics, major events such as change in life events such as graduation, getting a new job, or getting married is shown to cause depression, personal problems, substance abuse. Some symptoms include social withdrawal, low self-esteem, emotional pain, mood swings, suicidal thoughts and behaviors, feelings of self-doubt, hopelessness, helplessness, sadness, stress, denial, which can all lead to a compromised immune system, negative self-thoughts, insomnia, overeating or undereating, weight fluctuations. Treatments: lifestyle changes such as getting enough exercise done, having a good social support, getting sufficient sleep, and having a good nutrition and diet. Psychotherapy and medication. What you learn in therapy provides skills and insights assisting in reframing negative thoughts and employing behavioral skills combating depression. In some instances, however, medications may need to be prescribed to patients for more effective results.
Anxiety disorder. Anxiety is your body's natural response to stress and can be described as feelings of apprehension about what is about to come. Anxiety is only considered abnormal when it occurs in situations that most people can handle with little difficulty. Anxiety disorders include a group of disorders in which anxiety is either the main symptom, generalized anxiety or panic disorder, or is experienced when the individual attempts to control certain maladaptive behaviors, OCD and phobias. There are 4 types of symptoms associated with anxiety. They are physiological symptoms, cognitive symptoms, behavioral symptoms, emotional symptoms. Causes: stress from school, work, interpersonal relationships, stress from global occurrences or political issues, emotional trauma, medical illness, financial stress, side effect from medication, use of illicit drugs. Symptoms: physiological symptoms, heart racing, perspiring, tensing of muscles, aching stomach. These symptoms are all part of the flight or fight response. Cognitive symptoms: thinking that one is having a heart attack and thinking that one is dying. Behavioral symptoms: freezing up and rocking back and forth. Emotional symptoms: feeling a sense of dread, extreme terror, fear, and sadness. Treatment: counseling and therapy. CBT identifies triggers of anxiety and discovers the intensity of stressors, which provides assistance in managing the manner that their bodies and mind react. psychotherapy. When a person speaks to a mental health professional which reaches the root of their triggers to find suitable coping techniques, self-management, less severe cases, stress management, relaxation techniques, support network.
Psychosocial First Aid, PSFA. What is PSFA? According to the World Health Organization, it is the humane, supportive, and practical assistance to fellow human beings who recently suffered a serious stressor. The PSFA action principles include prepare, look, listen, and link. The first step is being prepared. Preparing is learning about the crisis event, learning about available services and supports, and also the safety and security measures. The second stage includes looking, observe for safety, and the people with obvious urgent basic needs, and for people with serious distress reactions. The third action is listening. Make contact with people who may need support. Ask about people's needs and concerns and listen to people and help them feel calm. Last but not least, link. Help people address basic needs and access services. Help them cope with the problems. Give them information. Connect with the people and all loved ones and social support.
Hi everyone, my name is Zaria and I am the Vice President of Psych CHI. So Psych CHI is an internationally recognized honor society in psychology that offers many opportunities to students to receive awards, grants, scholarships, and be afforded many research opportunities. So in order to be a part of Psych CHI, students must be pursuing a psychology major, minor, or special, must complete at least one academic year in psychology, or earn at least a cumulative GPA of 3.0 and above. So getting into the PowerPoint presentation, we're going to be focusing on PTSD, which is post-traumatic stress disorder. So PTSD is a mental health disorder that may have occurred in people who have experienced or witnessed a shocking, scary, or dangerous event. This may include a natural disaster, serious accident, terrorist activity, war, threats of death, sexual violation or violence, or serious injury. So on the right, we have a picture here that speaks to the DSM criteria for PTSD. So the first one that we're going to look at is stresses. So this may include any one of the following: direct exposure to a traumatic event, witnessing trauma, learning that a relative or close friend was exposed to trauma, or indirect exposure to adverse details. The following feature is intrusion symptoms, which speaks to unwanted, upsetting memories, nightmares, flashbacks, emotional distress, or physical reactivity after exposure to traumatic reminders. Next, we have avoidance, and this may be avoidance of trauma-related thoughts or feelings or external reminders. Then we have negative alterations in cognitions and mood, and any two of the following must be present in order for it to be characterized as PTSD. These include inability to recall key features of the trauma, overly negative thoughts and assumptions about oneself or the world, exaggerated blame of self or others for causing the trauma, negative affect, decreased interest in activities, feeling isolated, and difficulty experiencing positive affect. So next we have alterations in arousal and reactivity. So persons could experience any of the following: irritability or aggression, risky or destructive behavior, hypervigilance, heightened startle reaction, difficulty concentrating, or difficulty sleeping. So there's also duration, where symptoms must last for more than 1 month. Functional significance, there must be some kind of distress or functional impairment to daily life. And the symptoms should not be due to any medication, substance use, or other illnesses, and that includes exclusion. So in this slide, we have signs and symptoms. I know I've mentioned some of the symptoms before in the DSM criterion. So we'll refer to the picture that focuses on what PTSD looks like. So persons would avoid thinking of the trauma, may experience flashbacks, they wouldn't be able to concentrate, have difficulty sleeping, they feel guilt or shame, they experience a negative mood, negative thinking, they're always on guard, and they lose interest in certain activities, and they may also experience nightmares. So now we're going to look at some of the risk factors that cause PTSD. So the first one is genetics. So when we talk about genetics, we're referring to the mental health risks that are inherited from family members like anxiety and depression, and different features of a personality like temperament that directly affects how we cope with stress and in turn affect how we would be predisposed to PTSD. So another factor is neurological, which deals with the way our brain regulates the chemicals and hormones that our body releases in response to stress. So another factor that directly affects the development of PTSD is the experience or exposure to a traumatic event or past event, life stresses, or lack of support. So when we talk about life stresses, this could be losing a job, going through a divorce, or a painful breakup. Lack of support, this deals with lack of social support from family and friends when you actually go through a traumatic experience. Final thing that we're going to look at is treatment of PTSD. So psychotherapy, as we all may know, is the most efficient method of treatment. So I just outlined 3 different types that I'm going to go into right now. So cognitive therapy, this helps to identify the patterns of thinking, like one's negative beliefs about themselves or the risk of more traumatic events, and they try to transform these patterns of thinking into more positive ones as a means for persons to get better. So the other one is exposure therapy, which is a behavioral therapy that helps persons cope with facing both situations and memories that were frightening. So this helps to alleviate nightmares and flashbacks. A very popular program is virtual reality. They use this by putting persons in a setting or situation where that traumatic experience happened as a way for them to get over that fear that is associated with that event or traumatic experience. So moving on, we have EMDR, eye movement desensitization and reprocessing. So this couples exposure therapy with a series of directed eye movements that help persons to process traumatic memories and experiences and change how they react to them. And then we have medication. So there are 2 main types of medication that are used to help with PTSD. These are antidepressants, which help to alleviate symptoms of depression and anxiety. They can also help to improve sleep problems and concentration. Another medication is anti-anxiety medications, which help to relieve anxiety and related issues. Some anti-anxiety medications have potential for abuse, so they're usually used on a short-term basis as opposed to a long-term basis in order to curb that addiction. So I want to thank you all for tuning in to our presentation on PTSD, and I hope to see you guys joining Psych Chi to benefit from all the opportunities that we have for you guys.
Hi, we are the Peer Counselling Association of the University of the West Indies, and we're here today to talk about OCD, Obsessive Compulsive Disorder. So let's get into it. What is OCD? Obsessive Compulsive Disorder, OCD, is a mental disorder which causes people to have recurring unwanted obsessive thoughts or sensations, and these make them feel driven to do things to relieve that. These are the compulsions. There are several subtypes of OCD. There's contamination obsessions with cleaning compulsions. This is where your thoughts are centered around germs and around contamination, and so you wash your hands frequently and continuously and repetitively in order to bring peace of mind. There's hoarding, where you collect a bunch of stuff. There's symmetry obsessions with ordering compulsions, where you want perfection in your alignment of your things at your desk or arranging your clothing or anything in terms of organization, and so you compulsively organize. There's obsessions without visible compulsions, where you think but you don't act out on these obsessions. And then there's harm obsessions with checking compulsions. You think that you may have left the stove on, so you continuously check and check and check just to make sure that you didn't. And it's done as a method of relieving the thoughts in your head, these obsessions. Some signs and symptoms of OCD are, as we previously mentioned, intrusive and often distressing thoughts that are difficult to control, compulsions provoked by obsessive thoughts. It's also difficulty falling asleep or recurring dreams about the obsession. Then there's feelings of shame or fear or guilt, and this causes a decline in your self-esteem and your confidence.
When we talk about recovery from obsessive compulsive disorder, three main terms usually come to mind. Firstly, we talk about therapy, which usually comes in the form of either cognitive behavioral therapy or ERP therapy, which stands for exposure and response prevention. Now, to put it simply, with professional guidance, a patient is allowed to facilitate their own growth and recovery in this process by confronting the negative emotions that reinforce the obsessions and compulsions that they face in a meaningful enough manner that allows them to communicate the experience to others, as well as learn from it and grow to become better. Secondly, we talk about pharmaceuticals. Usually names like Luvox or Prozac are thrown around. These are antidepressants, but it's scientifically proven that in OCD cases they are just as effective because they help to regulate the amount of serotonin in one's body, which hinders the negative emotions that reinforces the obsessions and compulsions that makes OCD so difficult to handle. Finally, we talk about support, which I believe is one of the most important factors of OCD recovery. This involves family, friends, and loved ones understanding the importance that patience, understanding, and empathy plays in the growth and recovery of a person who is suffering from this illness and is on their path to becoming better.
Now, you all may be wondering, how can OCD impact people, especially during this pandemic? Now, most researchers would focus on depression and anxiety, but OCD should also be another key focus on mental health, especially in relation to the global pandemic and its effects on persons with OCD and without OCD. So research suggests that persons' fear of COVID-19 did worsen their symptoms of OCD. Other research suggests that the COVID pandemic and its behaviors associated with hand washing, cleaning, sanitizing can worsen persons' symptoms of OCD. So in conclusion, we looked at OCD, which is a mental health disorder associated with uncontrollable, reoccurring thoughts or behaviors that he or she feels the urge to repeat consistently. This disorder can manifest itself in various subtypes, which we have previously discussed, like hoarding and germaphobe or contamination OCD. Also, Trevor discussed a lot about the treatment options that persons could take to be able to cope with the fact that they have obsessive compulsive disorder, as well as being able to find support within their family and loved ones. As this presentation comes to an end, I would once again like to bring light to the services offered by the PCA. If you or someone close to you on campus is going through a hard time, there is someone willing to talk to, like a psychologist, or if you're a university student, you could talk to us. So reach out to us on Facebook and Instagram, send us a request, and someone will be there to support you. Thank you so much for listening to our presentation, and stay safe and take care, everyone.
You are all cognizant of the fact that COVID-19 came very suddenly on us, and it has led to an elevated awareness of threat in the environment. We do not know how long it will last, where it is going, how transmissible it is, and the outcome of it. This talk today on the psychological effects of COVID-19 will help all of us and our families who have been impacted by COVID-19 regain control of our anxieties and safeguard our mental health. We may also be asking ourselves, is there a reason to think that I am at risk? Why should I wear a mask? As is stated in the newspaper, I don't know if I have COVID-19, as it is clear that people can spread the disease before they have symptoms, or I don't know if the person I'm near to has a child battling cancer or cares for their elderly mum. While I might be fine, they might not. Or I want my community to thrive, businesses to stay open, employees to stay healthy. Keeping a lid on COVID-19 helps us all. What we know so far is that over 33 million have contracted the virus globally, and in Trinidad and Tobago, we have had over 4,441 confirmed cases of COVID-19 and 74 deaths and counting, and of course, community spread. Fear has gripped the world. Do we understand that we must physically distance ourselves from the person in front of us and behind and at the side of us so that we do not become infected with the virus? Or do we not give the virus to someone else? How did you get on with physical distancing, which was and is absolutely necessary during this time? But it may not be so natural for us to do because we are social creatures by nature. As Dr. David Bratt stated in his article in the Trinidad Guardian of July 7th, he said, "The truth is that all humans like to touch and be touched. When we are pleased and happy, we hug. When there is despair and sadness, we look for someone to hug. If there is no one around, we hug ourselves." One of the desperately sad things about the COVID-19 lockdown is the inability to embrace each other, even to shake hands. Elbow bounces are so cold. There are few touch receptors in elbows. Did you know that? Some of us already live alone. Now to be cut off from visitors, family members, friends and neighbors is something we have had to adjust to and have to adjust to. We are grappling with this situation, but there are still looming unknowns. We don't know how the situation will develop. We have had to make major disruptions to our lives. If we have no reason to be outside then, we must stay inside at home. COVID-19 has caused major disruptions to family life. Our school children have been affected in various ways. Schools have been closed, and we have had to quarantine. We must still wear masks, wash our hands often, and observe physical distancing, and of course, do not congregate. All of this is for our own preservation and that of others. Having said that, we must face the human consequences of COVID-19 economically, socially, and psychologically. Let's examine this. COVID-19 has caused many disruptions to family life. There are many challenges associated with families spending extended periods of time at home together. We are confined and economically impacted by the preventative measures that are put in place. We have to live all together in this little space, and we have to live as if everyone has COVID-19. Could you imagine if there are 10 children at home plus 2 parents, what the situation would be like? And have to spend all of this time together? Now that we can quarantine at home depending on the state of our infection, how are family members reacting to each other? Are they treating each other well so that those isolated feel comfortable and accepted and are able to cope psychologically? There are changes to children and young people's lives. Their daily routines have been interrupted and there is no access to education for some. Some have no computers or internet access. How are parents and their children really coping during this COVID-19 time? What is the state of their overall health and well-being? What about the parenting and the psychological symptoms exhibited by all? What about family life and the relationships therein? The literature states that due to this recent restriction, existing trends have given rise to divorce, a rise in domestic violence, sexual violence, and all kinds of violence during this time. Husbands and wives are not getting on well together at all, and they cannot tolerate each other. Tension rises, and there is too much stress and confusion. You know, some people find joy in attending work because they do not want to face situations they have been running away from at home. They use work as an escape route to deal with or not to face problems that exist at home. Because of this discord, which gives rise to violence, People find happiness elsewhere when they're out of the house, away from their families. This is the reality. However, this time, one must practice mindfulness when and where one can get in tune or in touch with one's feelings and emotions. And the question to be asked is, how do I feel about this current situation? How is it affecting my actions and behaviors? I may not be able to control this, but I can control my reactions towards it. So now is the time to turn within and come to terms with you. That is, with me. How do I feel and how can I react better? We hope that this time spent together for many can mend relationships between spouses and between parents and children. We also believe that men, women, mother, father, and the entire family all have to fight this pandemic together to overcome it. On the hotline that was initiated by the Trinidad and Tobago Association of Psychologists, of which I am a part, at the top of the list, the data showed anxiety, fear, anger, depression, loneliness, family relationship issues, unemployment, financial issues. Then it went on to psychiatric issues, general information and medical concern issues. All of these psychological issues were present, but were further exacerbated by the pandemic of COVID-19. We had calls from families experiencing frustration. Here are some of the examples. One man had a pre-existing mental health diagnosis and he was already alienated from his family. He had challenges of the stay-at-home order and felt really isolated now. Additionally, he had financial challenges and needed social services support to meet his basic needs. These factors resulted in increased anxiety, feelings of abandonment and fear that he will not be able to get food and his basic necessities. Did this happen to any of you? What we also found was that wives complained that their husbands seemed nonchalant about the COVID-19 pandemic and thought their reactions of anxiety were uncalled for. The wives expected more reassurance from their husbands, and this created tension. One even had to argue about her husband not taking precautions when he went to the grocery. Another woman over 60 said her husband did not relate to her anxiety issues and just told her to get over it. Here we thought that men were more concerned about finances, and this may be so because they tend to assume the traditional role of a man as being the breadwinner, hence his desire to be anxious or worried about the economics of this whole situation, rather than the emotional aspect of it. What we also observed was that men do not like to talk about their problems. However, some reached out because they had relationship issues before COVID-19, but these were magnified more than ever now because of the situation they had now found themselves in. And having lost their jobs, they just could not cope with life. Some expressed that they wanted to end it all. But after talking to them, some reasoning took place and they decided that there is life after COVID, which is going to be with us for a long time, and they must overcome and accept their situations to continue living. With all this activity restriction and reduction of pleasant events in the early COVID-19 times, we could not even go to the avenue to have a beer with a friend, or the promenade, to sit and lime and talk. Now we could do that a bit, but restrictions are still in place and we must abide by them. That confinement, though, brings fear, anxiety, depression, frustration, isolation, loneliness. Some people got what is called cabin fever, and this happens when you are confined for a long time, being indoors, and irritability, boredom, some hopelessness, and even restlessness and difficulty concentrating exist. Now, how do we cope with this situation that provokes unhealthy feelings within? And some of us just cannot come to terms with our new normal because COVID will be with us for all time and times. First of all, let's take a deep breath to put things in perspective. Let's talk about the children. We must be able to discuss this incident with our children so that they understand it. By now, I'm sure that they do. But what about their online learning experience? This is all new to us and we must be patient with ourselves, our children, the system, and teachers. We should maintain familiar routines as we go along as much as possible, or create new ones. Most importantly, we must create a learning environment, especially now that children must stay at home. We should also draft a timetable of activities so that they can have their time to do their work because they'll be disturbed. They can read their storybooks. They can play. There is a very structured timetable published in every Sunday Guardian. Use it. Of course, there can be family activities like playing board games together, trying new things, baking, engaging them in weeding the yard outside, cleaning the bathroom, and planting something. So everyone's needs will be met, and at the end of the day, life will be worth living during this time. How do we encourage parents to parent? One of the ways to do so is not being afraid to withhold any electronic device if rules are not being followed. As parents, we are in control. If we observe that our children get anxious or distressed by watching, reading, or listening to the news about COVID-19, we may want to minimize this a bit. But from the news, we can encourage them and teach them to wash their hands properly, how to use the crook of their arm for coughing, and how to use a tissue and dispense of it in the bin right after use, and to insist that they do not touch their faces. We cannot repeat these enough. With regard to how we ourselves react to information we receive, our children take cues from us on how to manage their emotions at any time. We must control what they see through the media to control their anxiety, and we must control our emotions so that our children know how to react emotionally to different situations. You must remember too that at this time, there is so much uncertainty and your children may become more attached to you because of this. What do parents say during these times of uncertainty and crisis? Let's talk about the most vulnerable in our society, and they are our elderly. Psychologically, they suffer from anxiety, depression, loneliness, isolation because of the lack of consistent support they require, and the disrupted routine that exists at present. At the homes of the elderly, the practice has now been reverted to no visitors. Could you imagine how they feel about not seeing their family members every day? We would not like them to be asking about, how am I getting my personal items, my groceries? How am I going to the doctor? They become afraid and anxious sometimes by the news that they consume. What we can do for our grandparents and elderly is to reach out to them virtually or by telephoning them often to find out how they are feeling and coping. We can also assist them by purchasing anything they may need. We must really stay connected to them, and this will go a long way in letting them know that we still care for them, even though we cannot visit them as often as we would like. How did you cope with the fear of infection? If you had family members who worked as nurses, doctors, ambulance workers, and others working in the healthcare system, did you become fearful of them when they came home? How did you treat with them? Did you avoid them or did you welcome them? Were you afraid of contracting COVID-19 from them? All of us at some time will be afraid of something. But how we respond to that fear is what will determine how we get through this crisis. COVID-19 has led to many losses, including loss of our jobs, loss of a loved one, loss of a relationship, loss of good health, loss of our freedom, loss of social connection with family and friends, loss of routine, no access to education for some, no linking with friends face-to-face, and schools have been closed. All of this provokes anxiety, stress, depression, uncertainty, and sadness. But regardless of the type of loss we experience, we go through several emotional stages before we are able to cope and manage the loss effectively. Some of us experience denial, shock, or disbelief. Some of us become angry. Some experience low mood. We lose our appetites. We do not sleep very well, and some of us cry a lot. Some of us remain very quiet and reserved and say nothing at all. And with all this loss, we experience grief. But if you leave these unattended, they may evolve into something you cannot control, and therefore, to cope effectively, you can and must find ways to express your grief. Accept your feelings. In the case of death, talk about it with friends or colleagues in order to help you understand what happened and remember your friend or family member. Try to maintain your hobbies and interests. Reach out and help others dealing with the loss. Remember and celebrate the lives of your loved ones. Take care of yourself as you grieve. Finally, contact the Ministry of Health, the Trinidad and Tobago Association of Psychologists, the Association of Social Workers, and any other institutions. They will refer you to the requisite professionals who can help you build your resilience and develop coping strategies to get you through this period of sadness. This has certainly been a difficult time for all of us. We became anxious and depressed because of the looming uncertainties, and we just cannot come to terms with this. Our new normal. How do we stay mentally healthy during this time and claim our resilience? I have prepared some tips for you on the ways to protect your mental health in the age of COVID-19, and here they are. 1. Take time to reflect on your own feelings and focus only on the things you can control. Don't judge or be ashamed of your feelings. Understand that it's okay to feel sadness, fear, frustration, confusion, loneliness, or guilt. The most important thing you should be focusing on right now is ensuring the safety of yourself and those around you, which means following COVID-19's rules and regulations. 2. Stick to your old routines as much as possible. Stay close to your normal routine by maintaining some semblance of structure from your pre-quarantine days. Having some sort of familiarity in your daily activities can make life feel more manageable. Studies have also found that our bodies tend to function better when eating, sleeping, and exercise patterns are set to a regular schedule. Number 3, go outside, be physically active. Just because we have been advised to stay in as much as possible, it doesn't mean we need to be imprisoned in our homes. If you find yourself dwelling on your problems and unable to stop, go for a walk around the block with your mask in hand. Research shows that exposure to nature not only makes you feel better emotionally and mentally, it also contributes to your physical well-being, reducing blood pressure, heart rate, muscle tension, and the production of stress hormones. It may even reduce mortality. Number 4, embrace the uncertainties and focus on the positive things. Embracing the uncertainties of this pandemic is something we struggle with most. Stop obsessing over things like what will happen next? How long will we be trapped in our homes? When will this all end? Instead, focus on the positive and uplifting moments. For example, the first Citizens Poetry Slam held last Sunday evening on television. We heard some of the finest minds there in poetry. Remember the Italians were singing songs from their windows to boost morale? This country was one of the worst affected by COVID. Number 5, stay connected. Don't isolate yourself completely. Good relationships help you to build a sense of belonging and self-worth. They give you an opportunity to share positive experiences. Make the most of the technology to stay in touch with friends and family. Email, text, message, video chat, Skype, Zoom. Use FaceTime. They are all useful, especially if you live apart. Offer support, love, and encouragement. People need people. Number 6, count your blessings. Gratefulness is a powerful tool. Be thankful for your health, body, and friends and family. And don't forget to thank the people who are facing COVID head-on, from doctors and nurses to delivery workers and the folks bagging your groceries. These are the heroes who are knowingly putting themselves at risk to serve all of us in the community. Number 7, seek professional help. To adjust physical distancing, many therapists, including me, have moved to telehealth-based platforms. If you find that you need professional help, consider using Zoom or your cell phone services, which allow you to communicate with mental health professionals through digital consultation. Take advantage of the online resources and hotlines as well. Now, during such a tumultuous time as this, adopting strategies, as I mentioned, to protect your mental health or prevent it from worsening will not only help you become comfortable with uncertainty and variables beyond your control, it will make your loved ones and your community much stronger. Thank you.